We've done a lot of boot camps before. This one is probably the most advanced.
For neurosurgical residents from across the Philippines and Southeast Asia,
So hard on the brain.
a select group of individuals are pushing the boundaries of human knowledge.
What they're doing is an orbitozygomatic craniotomy. What that means is they take part of the orbit and part of the skull, and by removing that, now you don't have to retract on the brain, and it's much more gentle and safe for the brain. And all you did was remove the bone.
Venturing into the last great frontier, the human brain. A place where skill, dedication, and collaboration converge to shape the future of medicine. This is the Manila Neurosurgery Bootcamp, a 2-day immersion into the complex world of the central nervous system.
We are especially proud to welcome our international and local faculty whose expertise enriches this program and ensure a truly world-class learning experience.
Let it rest in your hand, look at your entry point, and then go do your drill. And then last, your drill should follow the trajectory already. Rest, rest, there you go. Good, good.
A little push, reverse, anterior, posterior, medial, lateral.
So see those landmarks and make sure it lines up with that.
300 pounds, their chest is going to come here and that's going to bang
It's
into
a forum for collaboration, a place where challenges are met with shared expertise.
I think if you back up and just redirect way superior, you'll still be able to get it.
But the boot camp is more than just lectures and labs.
Thank you for taking time for the residents. I know that some of you had to come from the provinces. You had to take a plane ride just to be here. We appreciate it, and I do hope this will be a high-yield event for you. And then for our international faculty, welcome. Welcome to Manila. Welcome to the Philippines. Thank you for choosing the Philippines.
So, everything's very advanced, radiosurgery is available, systemic therapy is available. So more similarities and differences I was pleasantly surprised to find here.
Remember when I showed the presentation 0, 180 degree? 0 should meet 0, 180 should meet 180. So it should be a tension-free anastomosis. If you do that, then half of your work is done. As you could see here in the microscope, this is a part of refining of the microsurgical technique of our future neurosurgeons. So that's what we're doing right now.
And this training here is how to make holes in the brain so you can stick your tools inside. Here, they're taking out a large piece of the skull to a large area where you might have a tumor or a broken blood vessel.
So in this case, we want to
drill out.
We want to drill a little spot here, and then we're going to send that drill over this way. Now you might want to come back over on this side.
There's a lot of insights to take away from boot camp. Probably the most important one is to be aware of places like this that are willing to teach the residents and be very, very easy to work with. Because many times the residents are afraid to ask questions and they'd be worried that they're asking questions that aren't smart. And it just doesn't make any difference. You just ask the questions that help you gain more education so that you can be able to be a good neurosurgeon ultimately. And programs like this are what they make that possible. What the boot camps do is they give you extra training. More importantly, what they do is they allow junior residents just beginning their training to get hands-on experience and not be on patients, but be on simulators. All these models that we use really help residents to learn the basic techniques that they have to use in the profession of neurosurgery.
Stabilize the tissue with your forceps. Remember, try to keep your hands planted on the tables. There's some tension, so I'm going to try to bring that closer. Now try.
The pressure is intense, but the atmosphere is one of camaraderie, a shared commitment to excellence.
Because you don't want the suture to have to pull the vessel together, because this is a tiny suture and it doesn't have that much strength.
Can I pull the...
With your fingers?
Yeah.
Yeah, you can try, but it's so small, it's very hard to do.
So I should drop the needle first?
Yeah, you can drop the needle and then pull that through.
But beyond the technology and the techniques, it's the human element that truly defines the boot camp. These are individuals driven by a profound sense of purpose, a desire to alleviate suffering and improve the lives of their patients. They are the future of neurosurgery, and their journey is just beginning.